Hello friends, let us now learn the classification of malnutrition. So in the classification of malnutrition, we have number 1, grade 1. Grade 1 malnutrition or mild malnutrition, it is seen in 71 to 80%. We call it grade 2 or moderate malnutrition when the weight for age is around 61 to 70%. This is based on weight of more than 80% is considered to be normal. Okay, this is actually IAP classification, Indian Academy of Pediatrics classification. Then we have grade 3, which is severe malnutrition when the weight is around 51 to 60% of expected. Then grade 4, or we have very severe malnutrition where the weight of the child is less than 50% of expected. So this is the classification of malnutrition. Now one more classification we have, that is called as Gomes Classification. Gomes Classification is also based on weight retardation or wasting. Here the child is said to be normal reference child if the child's percentile is 50th centile of Boston standards. If the child's centile is 50th centile of Boston standards, then we call it as the normal reference child in the Gomes classification. So what do you say? See, weight for age percentile is seen in a child. In a child, weight for age percentile is measured by measuring the weight of the child with weight of the normal child of same age. So weight of the child with weight of normal child of same age into 100. So we will calculate this, and if we found out that it is 90 to 110%, if this value is 90 to 110%, then the child is normal. If it is 75 to 89%, then we call it as mild malnutrition or first degree malnutrition. Then if this value is 60 to 74%, then we call it as moderate malnutrition or also called as second degree malnutrition. If this value is less than 60%, then we call it as severe malnutrition or third degree malnutrition. So this is the Gomes classification. So because here we are taking weight as the parameter, so it is actually easy to compute. Number 1, it is easy to compute. So because it is easy to compute, it is widely used parameter, and this classification is also used as a prognostic value in hospitalized patients. In hospitalized patients, it is used as a prognostic value. The next important classification we have is Waterlow classification. So in the Waterlow classification, this Waterlow classification is mainly based on stunting. It is based on stunting, that is height for age and wasting. It is based on stunting and also wasting, which is weight for height. So how do you calculate this? You will take the height for age and weight for height is taken. If by weight for height is more than mean minus standard deviation, then it is normal. Then you will also see less than mean minus 2 standard deviation. And for height for age also you will see more than mean minus 2 standard deviation and also less than mean minus 2 standard deviation. Sorry, 2 standard deviation. Mean minus 2 standard deviation. Now, if you calculate the mean minus 2 standard deviation of height for age, and more than, if you find that the height for age is more than mean minus standard 2 standard deviation, and weight for height is also more than mean minus 2 standard deviation, then it is normal. If you found out that the height for age is more than mean minus 2 standard deviation, that is if height for age is normal but weight for age is less than mean minus 2 standard deviation, then there is defect in weight for age, so the child is said to be wasted. If the weight for age is normal, weight for height is normal and height for age is less than mean minus standard deviation, then you call it stunted. If both are less than the normal, that is less than mean minus standard deviation, then we call it as wasted and stunted. The child is both wasted and stunted. Now, if you see the nutritional status and percentage. So the nutritional status, if you see the nutritional status of the child, stunting percentage, stunting and also wasting. Now if you see nutritional status, stunting and wasting, if the nutritional status is normal in a child, then the percentage for height by age should be more than 95. If percentage of weight by height is more than 90%, then it is normal. Then if you see mildly impaired, we call it mildly impaired nutritional status if the height for age is 87.5 to 95% and weight for height is 80 to 90%. Then we call it moderately impaired if the height for age is 80 to 87.5 and if weight for height is 70 to 80%. Then we call it as severely impaired if the height for age is less than 80% and if weight for height is less than 70%. So this is the classification of malnutrition. Thank you.